Hi, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic. Thank you again for watching us on another exciting episode of The Learning Curve. Today with me again, I've got Dr. Jerry Anderson. And how are you doing, Doc?
I'm wonderful. Well, it's the hair. More on that in a minute. Go ahead with your introduction. Sorry.
No, it's okay. I just, we just want to talk about a few things today. One of which, and probably the main thing we want to discuss, is magnesium. Magnesium is a nutrient that we consider to be very, very important. It ties into a whole host of things, many of which we're going to cover today. And I just wanted to kind of get your thoughts on that, and we can talk about the hair real quick and why it's so spruced up.
Yeah, it's the Elvis hair phenomenon, folks. This is not my normal hair. My wife Terry, who is really an excellent hairstylist, has to do this because I'm in a play in Tullahoma, Joseph and the Amazing Technicolor Dreamcoat. I am playing the part of Pharaoh in this biblical story. Andrew Lloyd Webber, who also did Phantom of the Opera, did this amazing musical, and it is really quite good, funny, enjoyable, and I hope you get a chance to come and see it. Incidentally, my old friend and colleague, Dr. McClarney, Terry McClarney, who lives in Tullahoma, saw the program and came in at the reception afterwards and just was really excited. He said, "Man, I didn't know you could do this." He said, "You got a whole nother career ahead of you." So anyway, we had a lot of fun with it. That's the reason for the wild hair here and all. But the magnesium issue,
yes,
kind of important because as Dr. Russell Blaylock, the renegade neurosurgeon, was pointing out recently, talking about sudden cardiac death and magnesium, I thought that would be a good thing to talk about, and so that's our sort of lead off today.
Sure. I think one of the great things to talk about with magnesium to start out with, just because this is such a popular drink for a lot of people, is sodas, Cokes,
right,
all those types of things,
right,
because a lot of people don't realize what that's doing to your system way beyond sugar and caffeine and some of those things. Not to say those things are great for you, but you also have the phosphoric acid. And what are your thoughts on that as far as depleting the magnesium? And
well, here's the really interesting thing. Magnesium is difficult to magnesium nutritionally is difficult to assess because your blood level of magnesium can be perfectly okay, but because it's an intracellular ion, meaning that it's inside the cell and doing its thing, taking part in all the metabolic reactions, it's hard to tell if you got enough from your blood levels. And so your medical doctor who does fine blood work may, well, magnesium's fine. It may not be fine because, in fact, Dr. Blaylock projects that probably 75% of Americans are deficient in magnesium. And so to those who would say, well, so what, being a little deficient in magnesium? Well, when it comes to stroke, heart attack, other bad stuff, inflammation, being deficient in magnesium is really pretty serious. And seizures, I might add. Mm-hmm. He says, very astutely, he's a neurologist, or neurosurgeon, but he says, anyone is subject to a seizure if their magnesium level is low enough. Stroke, heart attack, seizure, if the magnesium level is low enough. And as you were just alluding to a moment ago, what depletes magnesium out of the body at the tissue level? Phosphoric acid. What's phosphoric acid in? Soft drinks, sodas. Doesn't make any difference if they're sugar-free or sweetened with aspartame, NutraSweet. The phosphoric acid is the culprit in the case of depleting an already suspiciously, possibly low supply of magnesium. Could soft drinks or anything else that depletes the magnesium from our systems, could that be implicated in sudden cardiac death? Mm-hmm. And of course, Dr. Blaylock wrote one entire paper about this. And so magnesium is pretty darn important. Mm-hmm.
One thing I really find interesting with magnesium that I see a lot with patients is magnesium's a precursor for a lot of the neurotransmitters in the brain.
Yeah.
So you'll definitely see it, everything from issues with not sleeping properly to things like ADHD.
Yeah.
It's a biggie, or it can be something as simple as it could tie into eczema, some skin issues.
Right.
Where you have some skin dryness and itching.
The
So
mo-
it's
yeah.
just it can affect a lot of different things.
The most serious problem with magnesium is that it's cheap.
Yeah. Sure.
I mean, seriously, this kind of ridiculous, but because supplementation with magnesium is not very expensive, the big money boys can't take a real humongous interest in it, and profit magnificently from it. So it's not being talked up a lot. But I know an internist right here in Winchester. I was surprised to see one day was recommending magnesium for a heart arrhythmia, for which his patient was having some problems, and
Sure.
I was impressed with that. I thought, good thinking, good call.
Mm-hmm.
And so anyway, now before, and we always need to make this disclaimer, before you go out and start experimenting on yourself with this sort of stuff, for heaven's sakes, get your own physician, your medical doctor, chiropractic physician, osteopathic physician, nurse practitioner, whatever. Get to somebody that can personalize the care for you and your particular needs. And Dr. Blaylock points this out. A person who is under care for a heart condition, you definitely want to mention this stuff in case there might be some interference with something that's going on, and supplementation with magnesium might have an effect on it. Now, sometimes the effects are positive. The supplementation might actually help the situation, but at any rate, we want anyone who is listening or watching in our audience to understand this. But
That's a great point,
Yeah.
and that's one thing I always encourage patients to understand is whether or not you're talking about magnesium or any other supplementation, or even if you're talking about exercise, you're always looking for the balance, and there's a fine line between how something builds you up versus when you cross that line, it starts to break you down.
Yeah. And I believe
So-
Dr. Blaylock recommends magnesium citrate, which is easily available. You
Sure.
you want to take the right amount for your particular situation. I think he recommends that most Americans take in about 1,000 milligrams a day of magnesium citrate, or I think he also recommends malate. But at any rate,
What are some of the foods that are high in magnesium? Like strawberries, I know are pretty high.
apples. But now here's the thing, Dr. Brad.
Yeah.
Vitamins and phytonutrients in a healthy plant are pretty much manufactured by the plant during the process of its growth and development. Minerals get there only if the soil has got the minerals in it.
That's a great point.
And so if you get an apple, and apples are supposed to be high in magnesium, but if the skins are cracked, that may indicate a magnesium
That's a
deficiency.
great point.
And also, with the means that we have, the modern farming and growing techniques, you may be able to protect plants from the otherwise effects of deficiencies. And so really supplementation may be the best way to assure, and it's really great to get the product or the substance, the magnesium, from our food if possible. But supplementation is probably a good way to go.
Sure.
But anyway, there's some other things that relate to this that we can take up in our next segment. Our very fine producer, Professor Will here, is telling us we got about a minute to go. So if you want
Sure.
to lead into our next segment with that, we can do so.
Absolutely. We are, again, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic. Please stay tuned. We are going to cover some more exciting things and give you some more insights into this nutrient called magnesium. Hi, I'm Dr. Brad Shapiro, again with Ultimate Health Chiropractic. We are here on the learning curve. Thank you for joining us again on our second segment. We're going to continue talking about magnesium and some of the things you're going to want to know about this substance. Once again, don't take anything that we say as treatment. If you feel like you might have some healthcare concerns, please go to the healthcare provider of your choice, whether it be a chiropractor like Dr. Anderson and I, a medical doctor, a physical therapist, whatever the case may be. Please consult whoever you need to. But one of the things that you mentioned over the break, Dr. Anderson, was the idea of food additives and the impact those types of things can have on magnesium and other nutritional aspects as well.
Something too, Dr. Brad, that I add when you're talking about our disclaimer there, we want people to understand we're not trying to treat them with this program, but we are trying to prepare them for a better health.
Yeah.
And that may be by way of being very prepared when you go to talk to your health provider. In other words, study up on this stuff, take some of the things that we point out, and be prepared to discuss those with your practitioner, and
There you go.
be enough of an informed consumer patient to ask for and get the correct answers, and that sort of thing.
Yeah, that's a great point.
One of the problems that we see, the food additives, and not to mention the pesticides, the herbicides that are used in farm type production and everything, they have potential for making us unhealthy. I had something yesterday, a conversation with my friend Dr. Johnson in Nashville, who does prolotherapy. He does a very good job at it, I might add. But he was talking about his conversation with a person who lectures on the situation concerning genetically modified organisms, modern farming that has been done to make crops resistant to the herbicide Roundup. And that discussion was really kind of alarming. The person he was talking about, who was lecturing on this, was talking about, you make the vegetable that you're raising more resistant to Roundup, and you can spray that in higher concentrations and really take care of those weeds. There's just one problem. Am I more resistant to the herbicide? Did I suddenly become genetically more resistant to it? Got to be careful with that. He also indicated, the lecturer he's talking about, said that male testosterone is lowered by exposure to this kind of pesticide or herbicide. And so a lot more caution is needed. He was talking about some things that happened in Brazil, for example, that warrant a closer look into the practices going. And he said this information, this is, hot off the press. It's not even, under much discussion yet. It will be. You heard it first here on the learning curve, the Ultimate Health Chiropractic. But anyway, the point that we're trying to make is that things that are in our culture, in our diet, in our society, that are somewhat toxic to us, we need to try to figure ways to minimize the intake of those things. And when it comes to the herbicides and pesticides, washing those fruits and vegetables, and in some instances just going ahead and peeling it, may be the safe route to go. But the things that are intentionally added to the foods, the monosodium glutamate, the excitotoxin, this is a tough one. There are about 40 different code names for MSG.
Yeah, that's true.
And I called a dairy distributor, we talked about this on the radio show yesterday.
Sure.
And said, man, what are you doing putting monosodium glutamate in your buttermilk, for heaven's sakes? And I said, we don't put monosodium glutamate in our buttermilk. And I said, oh, yes, you do. Here it is on the label. Modified food starch, another name for monosodium glutamate. What's going on here? And he said, well, I don't know. I'll check it out and get back to you. I think it's been about 18 months. I haven't heard anything.
Yeah.
And so anyway, but unless you enjoy being fat, having headaches, and feeling bad, unless you enjoy that, I'm being sarcastic here, you better listen up when it comes to the recently pronounced safe by the FDA food additive, monosodium glutamate. It comes in a bunch of forms, some of them as innocent as the words natural flavoring, autolyzed yeast, hydrolyzed vegetable protein, things of that type, yeast food, yeast extract. You want to be sure that you look at the ingredients, and if it's got a suspicious thing like that in there, you might try contacting the distributor, but be prepared for them to really not know what you're talking about. But at any rate, try to avoid those things, because it turns out that the glutamate receptors in the brain that are damaged by monosodium glutamate. It turns out that there are glutamate receptors not just in the brain, but all over the body and in every organ.
In the gut.
In the
is one of
gut,
the
you name it. Thank you for that. Yes, you're right. But there's another one I was thinking of, and that's the pancreas. The islet cells of the pancreas that produce insulin are also affected by monosodium glutamate. And what they do, the excitotoxicity of the product bumps up the insulin level. And so with an increased insulin level in your blood, it tends to cook the inside of your arterial venous system, and not good, atherosclerosis implicated there.
I know Dr. Mercola thinks that insulin may be the single best marker to regulate or to get an idea of what somebody's health is. It's that important, and it can affect so many things.
Good side point there.
Yeah.
But the increased insulin level also does one other thing. It tends to make you fat. It tends to store abdominal fat. And once you get that abdominal fat on you, as a matter of fact, the continued release of cytokines from the abdominal fat, for heaven's sakes, it starts having an effect on the endocrine system.
Sure.
It too tends to affect the pancreas. So anyway, he says, Dr. Blaylock, that you can potentially trace back the ill health effects to a single serving of food that's high in MSG.
Wow.
Yeah, and particularly in terms of brain health, you can go back a long ways. It makes it, it makes it seem sort of hopeless in a way, hearing that. But the good news is that you can reverse some of the effects of these things just by eating right and trying to avoid this kind of stuff in the future. And so if you want to stay healthy, you got to consider what's in the food that you eat and try to get it as close as one Dr. Blankenship says, a friend of mine, says you got to get it like God food. The closer
Sure.
it is the way God made it, I like the way he puts it. That's going to make it safer. But when you cook it, you want to do it right too, and avoid putting things in there like the trans fats, and
Sure.
and other bad stuff.
Yeah, one of the things you touched on that I think is such an important concept for people to understand, and that's just the idea that anytime you put something synthetic in your body, whether it be food additives, one of the realms I see it a lot with patients is when they tell me they're on a lot of medications. And again, I'm not anti-medicine at all. We both thank God for good medical doctors and prescription drugs when they are needed. But kind of back to the original point, whether it's food additives or drugs, anytime you put those things into your body's going to recognize the fact that they're not natural, they're synthetic, and it's going to have to pull out resources to manage those things, whether it lowers your magnesium or whether it alters your insulin levels. But your body's going to have to pull out all the stops to manage those types of things. So if you can at least stop and take the gas off the fire, and not throw the gas on the fire any longer by continuing to take those additives in, by making it worse. It can do tremendous things, and your body can, in many ways, heal itself.
In our next segment, one thing that we might want to mention too in this thing as far as food additives is high fructose corn syrup. The Corn Growers Association is fighting back. They're saying, oh, well, it's just sugar. It's, your body can't tell the difference. I wonder how they're getting by with that statement.
Sure.
But anyway, we can kick that around and also talk about fluoride in our water and other things that may have an effect on your weight.
Sure.
So
definitely. And thanks again for joining us here on the second segment. Again, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic. With me, Dr. Jerry Anderson. Please join us on our next segment where we will continue the discussion and touch on fluoride and some other important issues. Hi, welcome again back with us with the Learning Curve. Again, I'm Dr. Brad Shapiro with Ultimate Health Chiropractic. With me, I've got Dr. Jerry Anderson. And we were talking in the previous two segments about magnesium, and then we launched into the effects of food additives and insulin levels and weight loss and just all kinds of things. And now we want to kind of transition into, fluoride and some of these other components.
right, and as we always do is try to encourage people that watch and listen to our program here, and we're delighted to have you. Thank you for tuning in. Get this information and use that to collaborate with your health provider, whether it's a chiropractor like us, chiropractic physician, or a medical physician, osteopathic physician, nurse practitioner, whatever. Use this information not like it's treatment for you over there. We can't do that. Take this information and discuss it with the health provider of your choice. But there's some really heavy-duty stuff that's, well, frankly, your physician may not be up to speed on this. Talk to them about it. If they disagree, or you have some areas where you're not getting satisfactory answers, work at it till you do get satisfactory answers. One of the things that is of great concern of late is fluoride, because fluoride was put in the water. Oh, it prevents tooth decay. Well, there's some conjecture that maybe it's the improved diet, as far as around World War II, the end of World War II, I think, when fluoridation started becoming commonplace, that had more to do with preventing cavities than did fluoride. But at any rate, the source that I keep quoting on this, Dr. Russell Blaylock, the neurosurgeon of some fame, says that fluoride is extremely toxic to the thyroid. And the thyroid is what keeps you thin, or if it's not functioning right, makes you fat. So if it's incidentally hyperthyroid, can make you, that's a problem in itself as well. You want balance in there. You want the thyroid functioning at the optimum level, not damaged in either direction.
Of course, we're seeing a lot more of the Hashimoto's lately too, where people have the combination of some hyperthyroid symptoms and some hypo.
Good point, Doc.
Yeah.
Good point, Dr. Brett. The thing that Dr. Blaylock says that is of considerable importance here is that infants are advised don't let them brush their teeth with fluoride-containing toothpaste, because if they swallow any, it's bad news. Talk to a poison control center if your kid swallows some fluoride-containing toothpaste. And he says it's ironic that the same amount of fluoride in that toothpaste is in a glass of water.
Wow, I did not know that.
So that got my attention too. And so it may be that a form of purified water, filtration that specifically says it removes fluoride, or distilling the water and then adding replacement minerals back in so that you're not courting mineral deficiency, might be a good way to go.
Sure.
May be a very important way to go, particularly if Dr. Blaylock is right on this, that fluoride, and you can't just consider it by itself. You got to consider the other chemicals, the heavy metals that may be implicated in toxicity to the thyroid, inhibiting its function, that may be, as some doctors are suggesting, that a whole bunch of Americans are hypothyroid. And maybe not just real hypothyroid, but just sort of on that
just enough to
range.
Compromise their immune system
and
change their hormone balances.
You got it.
Basically
the whole
wreck
nine
their
yards
health.
Miserable stuff.
Yeah.
But anyway, we were also going to talk about high fructose corn syrup. The Corn Growers Association is fighting back with ads on television now are saying, oh yeah, there's a lot of concern about high fructose corn syrup. Well, what's the difference? It's just sugar. Your body handles it all the same way. That's not the way that I was taught. Fructose goes to the liver immediately for processing there, as opposed to sugar that is taken in, converted to glycogen or glucose and then glycogen and so on. That's a different thing right off the bat. Plus, high fructose corn syrup does not exist in nature.
Sure.
According to my reading, what I've been taught. It is a product that is genetically modified to make it much sweeter.
There's a book that the producer Will and I were reading yesterday. It's called Food Rules, and each chapter kind of has a bullet point of rules, and one of the chapters was entitled "Don't Eat Plants That Were Manufactured in a Plant."
That's pretty good.
So that would kind of be along those same lines.
That's pretty good. I love the way that Paul Harvey, the late Paul Harvey, the great radio commentator, used to put it. Just so you don't run out of things to worry about. And hey, listen, the purpose of this program is not to make you worry. It's to make you happier and make you healthier. What we want to do, though, is to advise you of things that may be going wrong. You know, if you're not feeling good, if you're overweight, if you're having a lot of struggles with your health, then maybe something that we're talking about here could lead you into an exploration of possibilities with your doctor, as we always admonish you to do. Might really make a heck of a difference in your life, as it did in my life. My chiropractor.
Sure.
Many years ago, incidentally, I love this story. I'll tell it real quick. The medical doctor that helped a lowly chiropractor, me, get started in his own practice here in Winchester, Dr. Fort, asked me early on when we were out at the airport talking. We're both pilots, and he thanked me for referring some patients to him at the emergency room where he worked, and he said, I really appreciated that. And I said, well, no problem. That's where they needed to be. And he said, do you guys think you can help asthma? Do you chiropractors think you can help asthma? And I could tell that sort of sideways glance he was giving me there. He's thinking, this is going to be good, you know. How could anything that a chiropractor does as far as manipulating the spine, adjusting the spine as we call it,
Loaded question.
have any effect on that? Yeah. And I told him, I said, well, Doc, that's what got me into chiropractic. I went in and told the chiropractor, said, look, I'm not hurting anywhere. I just heard you guys can take care of things like asthma without drugs, and I don't want to lose my flight physical from having to take asthma medications and stuff like that. I don't know if that was really a valid concern or not, but I knew that any drug that you had to be on often long-term could have an effect, might have an effect. But anyway, incidentally, I had no idea that a person could learn to ignore pain to the point that I had. This chiropractor, Dr. Lieber-Gazelle, found every sore spot, every miserable spot I had, and when I walked out of his office, I was a different human being than the one that walked in.
Because you grew up with a scoliosis.
Oh, yeah. Undetected by mainstream medicine and so on. But I was 20 and went on my own. But anyway, the thing that I found was that the asthma did respond somewhat. The adjustment, the relaxing my body, the better rest that I was getting, I functioned better. I was less prone to an asthma attack. But it was Dr. Lieber-Gazelle's associate, Dr. Logan Wentworth, who suggested food allergy. He said, Jerry, he said, I got a feeling food allergy is big time going on here. Incidentally, it was Dr. Wentworth who encouraged me to go to chiropractic school first.
Wow.
He and Dr. Lieber-Gazelle many years ago. But anyway, the possibility that a food allergy was going on, I told Dr. Fort, my friend and a guy that helped me get started in my own practice here many years ago, I said, it was that chiropractor's admonition to me, Jerry, look, you need to look at this. It could be there's food allergy that is causing your asthma.
What year was this?
1973, 74. Yeah.
Where they just didn't think there was any.
There's no
Anything to
connection.
allergies
There's no
or
connection
nutrition?
with food. Well,
Yeah.
there was. It was big time.
Yeah.
And changing my diet, getting the substances that I was allergic to, absolutely changed my life.
That's awesome.
And so anyway, that's why I became a chiropractor. I thought maybe these guys are real doctors after all, you know? And so, as I often say, it's sort of like being bitten by a werewolf, or a vampire. I got such great effect from chiropractic. The next thing I knew, I am a chiropractor.
Sure.
But anyway.
Well, thanks again for joining us. Again, I'm Dr. Brad Shapiro here with Dr. Jerry Anderson. We're with Ultimate Health Chiropractic, and we're also, just to give you a heads up, we're going to change the name of the show to Ultimate Health starting next week. So look out for the show entitled Ultimate Health. We're just going to continue what we've started with all this stuff, but just want to give you that heads up. And again, we will be on next week with more exciting nutritional and chiropractic information for you.